this is more than just ApoE4, and we do tend to think about ApoE4. It is obviously the most common genetic risk factor, and in large studies, it accounts for 60 to 65% of patients with dementia. But of course, that means that about a third, in some cases more than a third, are ApoE4 negative. And as Sharon points out here, in our study, where she was co-author along with Dr. Anne Hathaway and Dr. Kat Toops and Dr. Deborah Gordon, and myself, this was something where only about half the people that came through with cognitive decline, and they had clear cognitive decline by multiple criteria, but only about half of them in that study were ApoE4 positive. So it was really helpful. And this was published, it's freely available online, was published last year. And as she points out here, 11 actually out of the 25 were ApoE3/3, and 2 were actually 2/3s. So that single gene, although it's very important, is only a small part of the study and only a small part of the evaluation. And as Sharon and her team have shown, you can really improve your outcomes by looking at many other things. And as Sharon's mentioning here, we saw people down to MoCAs of 19. And by the way, there were 2 in the study who went from MoCAs of 19 all the way back to 30, did very, very well. So I think that, as time goes on, we can get better and better results, and we keep iterating and keep improving the abilities. We have not seen anyone go from 0 to 30 yet. That's our goal, but that's going to take some way to build back the synapses. And so again, getting in early, really, really helpful